Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hi, my name is Dr. Megan Pesch. I'm a developmental and behavioral pediatrician at the University of Michigan. I'm also the director of our congenital cytomegalovirus developmental follow-up clinic. Welcome to this podcast episode, Testing Positive During Pregnancy, One Family's Journey with CMV. I'll be your host today. This is part of a 6-episode podcast series called Let's Talk CMV. Today, I'm speaking with Lisa. Lisa, can you tell our listeners and me a little bit about yourself and your family's experiences with CMV?
Sure. Thanks, Dr. Pesch. So I was a pediatric speech language pathologist, and I was practicing in a public school. I had a toddler in daycare while I was working, and I was pregnant with my second child. During my first OB visit, my OB had a form to check off questions, yes or no, like, do you have exposure to lead? Do you work with hazardous chemicals? Do you have cats at home? Do you work with young children? And in parentheses, it said like a daycare provider or a nurse. And I remember filling out this form and thinking, I'm not a nurse, I'm not a daycare provider, but I'm with little kids all day long. And I clicked yes. So unbeknownst to me, checking yes on that form led them to test my blood for CMV.
Wow, that's great. I love that your OB gave you that checklist.
Yeah, I had no idea what the purpose was behind the question. But about a week after that appointment, I got a phone call from one of the nurses saying that I had tested positive with an initial CMV infection. Obviously, I kind of was going into a spiral at that point. What is CMV? What does this mean? Trying to find any information I could online and from friends or family.
Yeah, like that part of your story sounds so familiar. So many people don't know about cytomegalovirus, CMV for short. It's a very, very common virus. Mostly people experience it like a cold-like virus, but as you now know, if it's passed from mom to baby during pregnancy, it can be harmful. And most people haven't heard much about CMV. So I'm interested to know what did you turn up? Like, what did you find on your online searching?
To be honest, I don't really think I found much of anything. I didn't really understand what that could mean for me as a pregnant mom. As a speech language pathologist, I don't even really remember learning about it in graduate school. I even was asking some of my grad school roommates, do you guys remember about CMV? I just tested positive for this. They all just really kind of didn't remember much. We don't even remember learning that CMV was the leading cause of non-genetic hearing loss. And as speech language pathologists, that directly ties into the work that we do.
Right. But as far as people not knowing about CMV in general, it's unfortunate, but it's not unusual. So just a refresher for our listeners. So anyone can catch CMV at any age. Many kids become infected before they turn 5, and most adults in the US have caught CMV by the time they're 40. But once you catch CMV, the virus stays in your body for a lifetime. In terms of CMV, though, we think of different types of CMV infections. So there's what we call a primary infection, and that's the first time you catch CMV. A reinfection is getting CMV again, but maybe with a different strain of the virus. You can also get what's called a reactivation. So that's when an earlier CMV infection that's been lying dormant in your body becomes active again. Congenital CMV is when this virus is passed through the placenta to a growing baby. And so if that baby is infected, they then have what we call congenital CMV. And then perinatal, and that's when a baby gets CMV during or shortly after birth. And really, most of these types of infections of CMV are harmless in most people, so people with healthy immune systems. But for babies growing in utero, that's really when we see it being potentially problematic.
Yeah, this is the kind of stuff that at that point in our journey, we didn't know. We weren't really told all that information. And so when I saw my OB again, she told me, that it's a virus and that there was a chance this virus was transmitted through the placenta to my developing baby. I remember, her saying, we're going to continue to see you, but we also want you to go to a high risk OBGYN and they can do further testing. And we were educated a little bit more through the high risk OB. The positive for us was that they never saw things on ultrasound that led them to say there are grave concerns here. But on the flip side, no one ever kind of stopped to say, that's not the end of the story. There is more about CMV that you should know, that maybe we don't see things. It doesn't mean they're not there.
And I know hindsight is 2020, but that is a super important point. So how did kind of your next conversations with your doctors go kind of as the pregnancy progressed?
We needed to just continue monitoring. We
Mhm.
really went into delivery being told that like everything looked great. And the only thing that we would potentially need to worry about was hearing loss, which can't be seen on an ultrasound. And so we kind of were like, okay, speech language pathologist, baby with hearing loss, like we could do this. We thought we knew what the potential outcome was.
So how are you feeling before your delivery? And did you have kind of at that time even more discussions about what CMV might entail?
Yeah, I remember throughout the pregnancy just having like waves of emotions and sometimes
Mm.
feeling like things were okay or gonna be okay, and sometimes feeling, very worried or anxious about the unknown, as many pregnant women do. But I I think it would have been really good to have someone say that ultrasounds are a really great tool, um, but they're also a tool that's not perfect. And we can't necessarily see all of the intricate details of your baby's brain, your baby's liver, your baby's spleen. And these are things that we often find complications with babies who are born with congenital CMV. I probably would have felt a little more prepared for what happened when my child was born.
You're saying such great things. I think it's really important, for us as clinicians to be reminded that, kind of giving that full spectrum of what may happen, just so families are kind of prepared. And, I think it's also critical to remember that most babies with congenital CMV have no signs or symptoms at birth, let alone on ultrasound. So even the few babies, like in your case, where they're watching really closely, often those babies are born looking completely perfect and healthy. Um, some can develop complications later. So you mentioned hearing loss. Sometimes we see cerebral palsy, uh, behavioral disorders, developmental delays, balance issues. There's a whole wide spectrum of possible complications that babies can experience later on in childhood. So, even if they're born looking incredibly perfect and healthy. And so then, how did your delivery go?
So the delivery was the easiest part. Most
Oh
pregnant
my.
women don't say that, but it was a really smooth delivery. He looked good. The nurses and doctors looking at him, there was nothing that made anyone super concerned. But I kept saying, I had this initial CMV infection. You need to collect his first urine, and we need it tested for cytomegalovirus.
Wow. So it was you advocating for that, which is super important because babies need to be tested for CMV as soon as possible after they're born, and definitely within those first 3 weeks. So you were right to advocate for that.
Yeah, looking back, I'm really proud of myself for kind of sticking to my guns. But because my son looked so good when you looked at him, he didn't have overt physical signs at that time. I feel like I had to kind of keep pushing and saying, no, You need to collect his first urine, please. I had an initial CMV infection while pregnant, and we need to know if it passed to my baby or not.
And, that totally resonates. I think, right now it is not the standard of care for people to test infants for CMV. So, I think people really need to talk to their doctors if they're concerned about CMV or ask for testing for themselves or their newborns.
We completed the first urine sample and we were discharged home before those results came back. He was struggling with his weight and with feedings, but everyone felt very comfortable sending us home, myself included. But he continued to drop significant amounts of his birth weight past that normal range. We were taking him to the pediatrician every day for weight checks. They wanted to have close eyes on my son, which I'm so grateful for. But it was a lot.
That does sound like a lot.
Yeah, with a toddler at home then too. During one of those weight checks at the pediatrician, we couldn't wake my son up. And at that point, they said, we've got to transfer him. You've got to go to the hospital. We're very concerned. This is not normal newborn behavior. And I think that maybe the day before we had that weight check, we got a phone call that our CMV test results came back and that his urine was positive. And so we had that information as we checked into the hospital.
Right. So what did you do next? I mean, all of a sudden you were discharged home from the hospital with a healthy seeming newborn, and now you're a week out or so, and he has a diagnosis of congenital CMV, and you're on your way to being readmitted to the hospital.
Yeah, we transferred from our pediatrician's office to a children's hospital in our area, and we told them we just got confirmation of a congenital CMV diagnosis through his urine. They wanted to run more blood tests and even had to do a spinal tap to rule out other infections. And unfortunately, they found CMV in his blood and his spinal fluid. At that point in the hospital, inpatient, connected with in the infectious disease department, neurology, ophthalmology, audiology.
So you went from, oh, he looks great, to, okay, now we're critically ill in a hospital with all these subspecialists. I mean, as a mom, like, what were you thinking? What were you feeling?
I remember at some points like compartmentalizing. But I was also really sad. We didn't feel like this was a real possibility. And we didn't understand what that really meant to have a congenital CMV diagnosis. And so we felt unprepared for what that would mean for us and for our baby. We could have been more prepared had we had more information.
Wow. And it can feel so isolating. I remember that too. And just so our listeners know, so I also have a daughter with congenital CMV. She's 3 now, and very similar experience in some ways to yours, Lisa. I know for me, there was a lot of guilt, like, even like, what have I done? Could I have prevented this? Because I mean, for us, I was looking at my daughter for almost, 3 months before we had an inkling that she could have congenital CMV. So, for us, and I think for a lot of families, it is just so overwhelming. And CMV is so common. Like I said, most people do get it eventually. So, having it, or having a baby with congenital CMV, is absolutely nobody's fault. Most adults who get CMV or have had CMV in the past will never have symptoms, or will have very, very mild ones. So maybe a sore throat, maybe some fatigue, maybe some, swollen lymph nodes. And you mentioned you had a toddler at home, and I did too. I had a 3-year-old and an 18-month-old. But CMV spreads really easily through bodily fluids. So saliva, tears, urine, sexual fluids, even breast milk. And so a common way to get it is through the exchange of those bodily fluids. So for instance, kissing a toddler on the lips, or sharing food with a toddler. And then it could be spread from pregnant mom to the growing baby. It can also be spread through breast milk or even like vaginal secretions through delivery. Although when people catch CMV after they're born or during the process of being born, it's rarely, an issue. It really is kind of those congenitally infected babies or people who are immunosuppressed. So people can also get CMV through blood transfusions or organ transplants, stem cell or bone marrow transplants. And those people can be immunosuppressed. So I guess that would actually be an instance where we would be a little bit more concerned.
I wonder, like, well, why didn't anyone tell me that, when we're at the park, sharing my water bottle with my toddler or letting him take a bite of my apple, at snack time is something that could potentially make my developing baby sick. I didn't, know this information. I feel like it is preventable if you know what you're trying to prevent.
Yeah, I did the exact same thing. And I think, I think it's important for clinicians to have the conversation, like for people to have the conversation with their doctors.
Absolutely. We like society and the world tells us when we're pregnant to, not eat deli meat, don't eat raw sushi, don't scoop your cat's litter box, all of these things. But, no one really says, don't drink after your toddler, let your toddler drink and eat after you, because there's a chance of developing cytomegalovirus.
If I can cut down on my caffeine intake for my pregnancy, like I can definitely not take a lick of my kid's ice cream cone. We do these things in pregnancy to try to make sure our babies have, their best shot. And so I feel like at least tell people about CMV and then they can make their own decisions. Some ways that people might try to prevent the spread. So like we were talking about, not sharing food with toddlers or other people, really doubling down on the hand washing, especially after changing diapers, not sharing food, cups, things like that. Just, really simple things that you can do to at least give it your best shot to try to reduce your risk.
Absolutely. And, for us, this is where we are. We're a family that has a child with congenital CMV, and it's what can we do moving forward? How do we support him? My son Owen is now 5, and he's in a community-based preschool, and he's doing really well. He has really surpassed a lot of the anticipated limitations that were put on him when we got his diagnosis after birth. He has maintained his hearing, which has really surprised us, especially since that was the thing that we were feeling most prepared for. But he has his own, learning challenges and behavioral challenges. And we've done physical therapy for years and occupational therapy, feeding therapy, speech therapy. And we have had a great medical team supporting him and supporting us to help make sure that he can be the best Owen that he can possibly be, and set him up for success. But it has not been an easy road, and it has not been simple. And, looking back, I want everyone to know about CMV and to have that knowledge so that their child can be tested if necessary, and they can get that support that their child needs as early as possible to help their child develop all the strengths and work on any areas of need.
I love that. And no, it's not easy. No, it's not simple. But gosh, to me, it sounds like you are doing a great job. You are totally rocking this, Lisa. And I was wondering if can you tell us a little bit about what Owen is into right now?
So Owen loves Legos. He loves building with his brother. He's now he has a younger brother now as well, and so he's a big brother, and that's been really cool to see him get to kind of be in charge. He loves riding his scooter and going to the playground, and he is
Wow.
always climbing.
Oh my goodness.
So always climbing.
Your kiddo who has been in PT, physical therapy for years and years as a climber and a scooter. I love that.
And it's just in the last year, like he's now wanting to do things that we couldn't have convinced him to do before. He wants to draw, he wants to color, he tries to write some letters, and all those years of therapy, are have helped.
That is so great. Looking back, anything you wish you would have known?
I do wish we would have been told a little more about some of the possibilities, that there's a higher likelihood of learning disabilities. So even as your child hits some of the first motor milestones and the speech and language milestones, you know, they can't tell you at 4 weeks old, 6 months old, what your child is going to be like when they're 3, 4, and 5. And but just kind of being told, keep an eye on this, even if you feel like things are going okay. Those, yearly appointments are really important. And kind of knowing that stuff in advance can help families to have those things on their radar.
I do feel like giving people the ability to be prepared is huge. So, Lisa, thank you so much for joining me today. It was so great to talk to you, and I appreciate you being so open and sharing your story. Any final thoughts that you wanted to share or advice for our listeners?
Yeah, I would also just add that there are other families out there that have this diagnosis, and finding your support network, not just for your child, but for you as a parent, is going to be really important. And just like all parents, the journey is difficult at times, but there is still so much joy in it. And finding the joy in each of those little moments and each of those successes, even if they're not exactly what you thought they would look like, is going to be really important on your parenting journey, and being confident and advocating for yourself and for your child.
Yes, amen to that. Thank you so much for joining me today, and thank you to our listeners as well.